Hey, you guys! Want to welcome you to Moving People to Action conversations with a focus on solutions. I want to thank you for tuning in. Please, if you would, share the link. We're doing a live feed on social media. This is going to be some very meaningful conversation about the COVID-19 variants and really what's happening. Yeah. And so what can we do to be proactive as we look at dealing with this COVID-19 and especially the variants that we're faced with, and really to set the pace for the conversation tonight. I want to welcome Raheem Sanders to really kind of help us really set the tone for the discussion tonight. Joining us later on will be Dr. Dele Davies and Dr. Lindsay Huse, the director of Douglas County Health, and Dr. Davies, University of Nebraska Medical Center, a vice chancellor and a specialist when it comes to infectious disease. So with that, Raheem, talk to me, man. Help me set the pace for tonight's discussion.
All right. So first and foremost, happy 2022. We're in a new year. We got new opportunities, but even with the new year, we still got some old year things going on. And the most important thing is the COVID-19 worldwide, the impact has been over, 5 million deaths. I think this week alone in the United States, it's been reported that the cases have been going up. It's been shattering global records with this new OMICRON variant. And with all the new cases and all the things going on, it's having a very big impact on our workforce and our healthcare system. And most importantly, our economy. There's been a shortage of workers and consumer goods. There's been a lot of things going on in terms of how the COVID-19 pandemic has impacted today's society. But with that, though, it's also supposed to be some good things to look at. In the beginning of the pandemic, we lacked a lot of things. And one of them was the capacity for testing. A lot of these new cases are being found because we've upgraded the way that we've been able to test these new things. And just Monday alone, we've had the resources to identify and diagnose over 1.3 million new coronavirus infections. And that's something that's a milestone, because in the beginning, we didn't have a lot of these resources. And speaking of resources, we've also been able to get more medical devices to help treat or diagnose this COVID-19. So like the test and the mask and the different gowns and sterilizers that's necessary to get this done. But also since we've had this leg up in getting these resources, again, there's a lot of shortages that we've seen due to this pandemic. We've talked about it before with the healthcare workers. There's a lot of shortages on the healthcare spaces and our hospital and our ICU beds. We talked about our consumer goods, the school and education for our young kids. And I think most importantly, what a lot of people aren't focusing on is just the lack of focus on other diseases and illnesses, being that there's a high focus and high resources provided to treat COVID-19 in our communities. It doesn't leave a lot of opportunity to treat our cancers and our diabetes and our other, illnesses that have been impacting our community. That's kind of where we're at in terms of the state of COVID-19 today.
So, Raheem, when you think about the conversation that we're going to have with our subject matter experts and our guests, what are we anticipating as far as questions being answered. Folks out there we're live streaming this on Facebook, and so please share this. Share the link. It's also going to be on YouTube, our YouTube channel, Moving People to Action. But questions out there, and of course, we're encouraging people to ask questions. And but what are we trying to get done? I know we said this is a focus on solutions. Yeah. So what kind of questions are we trying to and we're anticipating answering tonight?
All right. Well, I'm not too sure about normal people, but what I have been seeing in terms of the news and the different types of things going across social media, I think a lot of questions tonight are going to be focused on the medicine, like our vaccines, with all these different variants. There's been pushes for the vaccine. There's been some things going around about the effectiveness of those vaccines with these new variants. So I think the people are going to be curious about how these vaccines are faring out right now during the pandemic. And along with that, there's been reports about pills that's being developed also that can help this. So I think people are going to want to know what preventative services are available to us, either in the form of medicine or health and wellness. And along with that, people want to go outside. They want to get back to how things used to be. And I think a lot of questions are going to be around, what does that look like in terms of establishing a sense of normalcy? What is our economy going to look like as we try to get out of this thing? How is this going to impact our jobs and in the education? And like we talked about before, what does this look like for new opportunities for the new year, especially as we use technology? Because a lot of people have been, migrating towards technology during the pandemic, but really, what does that look like as we begin to move forward in this new year? So I think a lot of the questions tonight are going to be around the resources we have available and how do we use those to regain structure and operations. And I'm not too sure about local people, but I'm pretty sure they're going to have a lot of questions for Dr. Huse too, because there's a mass ordinance in place, and I think people are going to want to know about that. So I think those are the things we can anticipate for tonight.
Yeah, right on. I appreciate that. And with that, hey, let's begin the conversation. I want to bring on Dr. Dele Davies, University of Nebraska Medical Center, and Dr. Lindsay Huse, Director of Health for Douglas County here in the Greater Hall area. Let's start the conversations right there. And please, let's go ahead and bring them on, and let's check our technology. And here we go. I can see Dr. Davies, Dr. Huse. Welcome, you guys. Welcome to Moving People to Action. And really, what we're trying to accomplish here is just a real conversation about what's in front of us. As you can see on my laptop here, I now have my vMix output coming into my Zoom. Most of all, so that's now being received via this laptop. For some reason, we're having some feedback there. I think we're good. Okay. Most of all, I want to spend most of the time about, so often, we spend time talking about the problem. We have to, so we can understand really what it is that we're trying to solve. But I would really like us to spend time mostly on our way forward and solutions. So if we could start with Dr. Huse, just high level for you, what's the state of COVID-19 as it relates to the variants? And let's talk about that, and then we'll bring Dr. Davies in on the conversation.
Sure. Thank you for having me on the show, and very happy to go through that with you. So the state of COVID-19 in Douglas County right now is that we are currently still increasing. So we have actually tripled our case counts over the past few weeks. So, around Christmas time, we were sitting at about 400 cases per 100,000 for a 7-day total. As of today, we were over 1,500. So we have certainly had a vertical movement up in those case counts. Most of those cases are Omicron. So it has certainly overtaken that Delta variant. So Omicron is now the predominant variant. And that's true across the nation at this point. It's not just here in Douglas County. We do know that Omicron is more transmissible, so it's easier to pass from person to person. There's some evidence that it could be less severe in illness than Delta was. However, when you have that many people that are getting sick, you're still going to have a pretty high number of hospitalizations, people who need really high level acute care in the hospital setting. And unfortunately, you're still going to see some deaths as well. So our big worry right now is just really that we're seeing just so many cases. That's a strain on our healthcare system. It's a strain on the economy because now you have businesses that their workers are calling in sick, unable to come in, or they've been exposed. We have difficulty keeping some of our learning environments going with schools. So now what we've seen in Europe and in South Africa is that Omicron had like a pretty big spike and then it came down pretty quickly. So what they saw was really cases increasing pretty dramatically over about a month, a little over a month, and then it had a pretty steep decline. So fingers crossed that we will also see that here, but we also have to anticipate that lag in hospitalization. So even though we'll be coming down, we may be seeing those hospitalizations going up as well.
Thanks. And Dr. Davies, if we could do just a takeoff from that, from your world, your perspective, really from academia, give us some perspective in terms of where we're at and really how do we move forward? Where do we go from here?
Well, I think, just building off on what Dr. Huse said, I'll just give you some perspective. The original COVID strain, whenever one person got infected, they passed it on to maybe 3 people. With the Delta, when one person got infected with Delta, they passed it on to maybe 5. With Omicron, they're passing it on to between 7 and 9 people for everybody who gets infected. So that means that, the first group of people pass it on to 7, and then 7 times 7, and then it just multiplies. That's why we're seeing this incredibly steep curve of the number of people who are getting infected. And so the biggest challenge we face right now is because so many people are getting infected, the hospitals are overrun. Just today, Nebraska Medicine declared a crisis standard of care. What that means is that they can no longer provide the normal, or we can no longer provide the normal care because we don't have the staffing. A lot of people are off, a lot of staffing are off sick, and the hospital is filled with patients who are taking up the bed. So if somebody were to need elective surgery right now, they're going to have to wait. And so, we've done everything that we can as a health system. Now we're asking the public because, we need the public's help. And I think what, the kinds of efforts that Dr. Huse has taken in putting in a mask mandate, what that just does is it just allows the health system to breathe. So that if you have a loved one who maybe is needing urgent care, we want to be able to take care of them. But given where we are right now, it's a real stretch. And so that's really the issue. Now, the way forward you've asked is, we have to go back to the basics, right? We talked about the Swiss cheese analogy, that the more layers of control we have, the easier it is for us to control the outbreak. So wearing a mask. Now, we know that Omicron seems to spread even better, than the other viruses. So we actually, at least in our institution, recommending not even wearing cloth masks anymore, but wearing, the surgical three-ply masks or KN95 type masks. That's the first thing. The second thing is that get vaccinated. If you have not received the vaccine, you should get it. And if you've gotten the vaccine and you have not gotten the booster, get the booster. Because here's what we know. If you have received the vaccine, you have a much less chance of getting sick compared to somebody who's not received the vaccine, even with Omicron. If you've received the booster, your symptoms are even less severe. So getting the vaccine and getting boosted is really a key part of keeping this under control. The second thing is that if you're sick, stay home. Because, what we're finding is that because a lot of people, Omicron in a lot of people is just, may feel like the common cold or a bit of a cough. But, you go out there, and as I pointed out, if you're in contact with people, you're going to infect 7 to 9 people if you're sick. The third thing is that keep your bubbles small. So, avoid large groups, maybe if you're going to interact, mix in smaller groups, and then if you're not sure, get tested. I know that there's a lot of talk about whether or not there are enough testing sites, but we do know that there's testing sites available in Douglas County. So if you're not sure if you have COVID, go get tested. And then back to the basics, the same things that we did at the beginning of the pandemic: frequent hand washing, social distancing, wearing the mask. These are all things that are going to be very, very important if we want to get this thing under control. Just remember, we're trying to do this not just for ourselves. So when I go out and I wear a mask, I always tell people, I'm not doing it for myself. I know that I'm fully vaccinated and boosted. I'm doing it to prevent myself from getting even colonized and passing it on to somebody who may be vulnerable. So please think about the community when you're making this decision. So not just about you, but think about your grandma or your neighbor's child who has cancer, or maybe somebody in your house who may be vulnerable. So think through the decision carefully, not just for yourself, but for your household and for your neighborhood and for your community.
And really, that's really just a higher calling and responsibility that is so much bigger than ourselves. We have to do what's good for our loved ones and the common good of humanity. But Dr. Huse, when one of the things a proactive move that Dr. Davies talked about in terms of getting the vaccination, and then following up with the whole series plus the booster for the folks out there that are still reluctant, have not decided. Can you talk a little bit about, one, why are we highly recommending, because it's a choice still, but why are we highly recommending this? And then one of you guys, tell me what's in this vaccination, because there's so many things out there. There's so much messaging out there. Is there microchips in there? Talk to me first of all in terms of why is it important and what's in it?
Yeah, I can start off with that.
If you please.
Yeah, absolutely. So first, I can assure everyone that there are no microchips in the COVID vaccine, none of them. That is not something that has happened. It is so important, though, for people to get vaccinated, because even if you have a breakthrough case, and that means you got vaccinated and you still got COVID, it actually decreases the length of time that you are contagious to other people. So that means fewer people that you could potentially expose. So that's really important from a transmission standpoint for keeping those people around you healthy and safe. It also ensures that you have a much milder illness. So the vaccine was really invented not to prevent 100% prevent illness. No vaccine is 100%. But what it will do is make those symptoms less severe. So instead of you ending up in the hospital or on a ventilator, or even dying, you're going to get maybe a moderate case or a mild case of that. Some people even, they get it, but they're asymptomatic, which means that they don't have any symptoms. They really just don't even know that they have it. Unfortunately, they can still be contagious at that point. But that is much better than getting so sick that you're going to end up in the hospital, or even, passing away from this illness. And that's ultimately what we want to prevent. If people are going to catch it, we want people to be able to recover very quickly. We don't want them to have long-term consequences from that illness. So, we see people who end up with that long COVID, which means that you just continue to have some level of disability really from that illness, whether that's fatigue or your immune system is just kind of attacking your body in different ways, multi-inflammatory syndrome. There are a number of things that can result from having that illness, and being vaccinated decreases all of those chances. So we want people to get vaccinated. So the booster is super important when we're talking about Omicron, because the vaccine is slightly less effective against Omicron. It still works, but it's just slightly less effective than it was for Delta. But when you add that booster in there, it actually increases the efficacy or how well that vaccine works again against that Omicron variant. So that booster becomes even more important.
Now, from Dr. Davies, from a perspective of minorities, or especially Black men, I'm still running into a lot of folks, particularly Black Americans, African Americans, people of color, lack of trust. Talk to that a little bit. Have we come a ways to where we should not have that front of mind so much, in terms of to have some degree of confidence of what's taking place right now based on what we've experienced in our past?
Well, so Tim, I think that, I understand the historical context of the lack of trust. And I think that it's important to acknowledge that. And I understand where many people may be concerned because of what they might have, had their grandparents or in their family line go through. Here's what I would have to say. If you look at who's been predominantly impacted by COVID during this epidemic, without any doubt, the communities that have been mostly affected have been communities of color and American communities. And the number of reasons for that, a lot of the frontline workers and, are persons of color. A lot of persons of color have underlying conditions like obesity, diabetes, and other conditions that put you at higher risk. And so, that's one aspect that we need to consider. The other aspect is that, if you look at this vaccine, we have two vaccines. The predominant vaccines that are currently in use, the mRNA vaccines, we now have over, I think 7 billion the last, so maybe, the number is changing every day. Billions of people have been given this vaccine. And it's one of the most highly utilized vaccines in the history of humanity in terms of the number of people, especially adults, who have received any vaccine. So in tons and tons of safety data, it is as safe as any vaccines that we know of. Clearly, there's some very rare side effects, but the side effects even that you get in comparison to having COVID itself are minimal. So we have to also think about who are the people who are getting the vaccines. The vast majority of healthcare workers, the vast majority of politicians have received the vaccine. So the question we need to ask ourselves is, what do they know, or what do other people know?
Right.
That we don't know. And so I think it's important. As I like to say, we want to make sure that we do everything to protect our loved ones. And there's nothing better right now than the vaccines to protect our loved ones. And I've seen more than one case where somebody who was holding out on the vaccine got really bad COVID. And unfortunately, either they've been severely harmed, or at their funeral, they have COVID vaccine clinics. I think that we don't want to wait for funerals to have a vaccine clinic.
Yeah.
Do it now, and protect our communities.
And both have been talking about just how overwhelmed our hospital systems are, and what they're seeing. What percentage are we seeing showing up at the hospital that's currently unvaccinated? So is it a larger percentage that are showing up that's
Absolutely. The vast majority of people who are in the hospital are unvaccinated. Now, I will say one thing about Omicron. Because Omicron is spreading so rapidly, some of the people who are admitting to the hospital, we're testing them obviously because we want to know if they have COVID, but they may be coming with a broken leg, and we find that they're COVID positive, they're still taking up a bed. So we still have to go through isolation procedures. So from that sense, we're seeing more quote unquote vaccinated people who are in hospital who may be COVID, who may have Omicron, but that's not necessarily the reason they're there. But if you look at the people who are there for COVID, who are sick with COVID, the vast majority of them have not received the vaccine.
And that's where, I mean, yeah, it's so painful when I hear I just got a call today from a friend that his brother is hospitalized, basically fighting for his life. And he was one that chose not to vaccinate. And so he's really, the Omicron is really bearing down on him pretty heavily. And, hopefully he makes it. But I think it's just, we're in a situation where people are making choices not to vaccinate, but it's causing so much pain on our system. Now, question to both of you: when do we pull the trigger when we look at some states are calling in the National Guard, the federal reinforcements to help dial down some of the pressure in terms of the hospital systems? When do we make those decisions? Almost, I would like to, how do we be proactive? Because you're seeing, I think Dr. Huse just said our we're at about 92%, or somebody with, in terms of we're in the 90s as far as our capacity right now.
Yeah, so we definitely are, even though that doesn't sound like it's all the way at capacity, we're really at capacity.
That's a lot.
Yes. So even, I mean, you're talking about 92%. First of all, that changes every day. So those numbers basically get reported daily. So, it can vary a little bit, but we're pretty regularly sitting above 90% in terms of especially ICU capacity. And that is certainly very difficult. And the people who are actually that are working in the hospital setting, so your doctors, your nurses, your respiratory therapists, all of these people that it takes to take care of a patient, which is a lot of people, they're actually being assigned more patients than we would typically give them. So, a nurse on a floor might typically get, let's say, in an ICU would get 1, maybe 2 on a bad day to take care of. They're currently taking care of upwards of like 4 patients. That means that the care that they're giving can't be as good because their attention is spread so much thinner. So when you take that into account, not sure 92%, but really we're at capacity. They really can't take more patients. So that's kind of what we're seeing across the metro and regionally as well. I know other hospitals across the state, especially like our critical care access hospitals in rural areas, are really struggling right now. So it's even hard to find a bed in a different hospital if you need to transfer a patient out.
Yeah.
In terms of calling in reinforcements like the National Guard, that's really a call that would have to be made by the state. So that is something that the governor could certainly do if he felt necessary after consulting with his people. But that isn't a trigger that we have available to us at the local level.
But you guys have to promise me, if it gets to that point, Dr. Davies, in terms of just with you and Dr. Gold, you got to say you will not hesitate. And I know, Dr. Huse, you will not. You guys, we have to be very proactive, I think, and not reactive. And hopefully the governor would adhere to the wishes of the folks that are on the front line. And if you have any problems, let me know, and I will personally call him myself. A whole lot of folks will call him, okay?
Yeah, well, I can reassure you, Tim, that, the health system, we look at what's on the ground, right? It's really about who's there, and so that's how the decisions are made. We're not really, it's not a political organization. We just try to do the right thing for the patients.
Yeah.
The other thing that I want to just add to what Dr. Huse said is, the 92%, there's another problem with it, because that's just the bed capacity. The staffing is also down, right? So we don't even have the staff. So it's a combination of not having the beds, but also not having the staff, because we have so many. On any given day at Nebraska Medicine, we may have 400 staff who are away right now, who are not well. So that's another contributing factor towards the situation we're in right now. That runs across the gamut for the whole state. And so if you have as Dr. Hughes said, if you have a hospital, a critical access hospital in rural Nebraska, where they can only handle so many types of patients of certain levels of complexity that want to transfer to places like Nebraska Medicine or Methodist, they may not be able to do so because there's no ability to transfer those patients. That's why we're saying, we are doing all we can as a healthcare system. We're asking the public to help us. It's really a plea to the public to please, it's like we're living a totally virtual reality life where we're living one world and the public doesn't seem to really appreciate the challenges that we're facing in the healthcare system. And we need help. We're doing all that we can. Dr. Hughes is doing what she can. We need the public to do what they can, and that's get vaccinated, wear your mask, socially distance.
And really, what I'm hearing is, those 3 or 4 points that you pointed out, that's how the people can help, the community can help stress this thing down by getting vaccinated, social distancing, washing your hand, getting the booster, and if you, I heard you say, if you're sick, stay at home. Now, some may say that's easier said than done, because the reality is now the government is not subsidizing some of the companies, so people they may have a little cough, but they don't have no vacation time, and so they have to go to work. What do you do? And so it's difficult. It's a challenge.
Well, I would say, and I hear you. I think the challenge there for the employers is if they don't encourage people who have symptoms to stay at home, they're going to lose a lot more employees. So it's really taking the long view and saying, okay, stay home if you're sick. We're telling that to our employees here. If you're sick, stay home, because we don't want to, spread it to the rest of the employees who can't show up. So, it's important that if you are sick, check with your employer and let them know. My suspicion is that most employers will say, stay home.
Yeah, and it ain't like they can't work from home, right? I think one of the things that this pandemic has done, it really has caused us to pivot and to prepare ourselves to work from our homes, a little bit more virtual communication. And so lessons learned. I think what you're saying, you're going to pay for it later if you don't do right by the environment in which you're trying to control people from getting sick.
If you are sick with Omicron and you go to work and you're exposed to 7 people, you're going to spread it to 7 of them. That's how infectious it is. So, you're going to, it's not a matter of if, 7 people will be infected who are vulnerable. And so if you don't stay at home, you're definitely going to spread it.
We're going to start opening up for some questions. But one question got sent to me. It says, I heard, or what does it mean when someone's toes turn blue, or if they were told it was due to COVID? Have you heard anything out there in terms of somebody's toes turning blue?
Yes. So there is a condition that's been associated with COVID that is associated with the toes becoming blue, warm, swollen, and they're calling it COVID toes. And it's really felt to probably be related to, again, the immune response or some clotting or something that's going on. So it's really a direct manifestation of the immune system acting against the toll itself. So it's one of those things that, you know, we're seeing that are weird that we never saw until we saw COVID.
Yeah. Now, Dr. Huse, for yourself, and reiterate what's the importance of, the mask. You hear people say, well, dang, you know, the mask is not going to do this, not going to do that. But there's a reason why you have called for a mask mandate in terms of masks. I wear my mask inside my house sometimes, you know, when I go out and trying to be safe and be, you know, just abundance of caution. But talk a little bit about, you know, I think it's just part of just, we all, just like I challenged, I said, Dr. Davies, Dr. Huse, when are we going to call the National Guard? And Dr. Huse said, well, hey, that's not my authority. That's the governor's authority. But in your authority was to do what you did and really reiterate in terms of just the importance of why you did that and what's important in terms of that mass.
So really the reasoning behind that, as I have stated a couple times, is looking at those numbers and how quickly and how much they've increased. So having them triple in a matter of, you know, a few weeks is incredible. If you go on our dashboard and you actually look at the graphs, you've got like these nice little rolling, you know, kind of waves, and then you have this line that's shooting straight up. It's crazy to look at, and knowing what's coming from that. So as we have more people getting sick, we're going to have more people in those hospital beds, or who are going to need hospital beds. But unfortunately, like we just talked about, if you're 92% full and everybody is taking care of more people already than they should be, there's nowhere for anyone to go. And that leads to more severe illness and potentially death. I've heard projections from some of the scholars at UNMC that they're expecting a need for kind of at a minimum of 40% increase in hospital capacity, maybe even up to 80% or more. That scares me to think, what are we going to, first of all, who's going to take care of all of those patients, but also thinking about just the level of disability and death that could result from that, from those people not being, the COVID patients not being able to get a bed, but also all those other people. So hospitals are busy all the time. We have people having babies. We've got people who need cancer treatment. We've got people having heart attacks and strokes. Where will all of those people go? We've got to make some room for them. Also major concerns, like I talked about earlier, with all of those people who are calling in sick. Small business owners cannot keep their doors open when they have nobody to work. So, you know, we've got multiple things happening kind of in a convergence in the community. And we've got to do something to create some room. So that really, you know, we can still encourage the social distancing. We can, you know, we're of course vaccinating people as much as we possibly can. Anybody who comes in, we're getting shots in their arms if that's what they want. But masks really are just another layer that we can apply. They are not a perfect solution. Masks do not completely stop you know, every single little viral particle, but they slow it down. They make the amount of virus that's, you know, coming out of somebody's mouth, it contains a lot of that. So you have fewer people that you're potentially infecting if you're infectious. So even if you prevent, so Dr. Davies talked about that R naught, or, you know, basically, if you have one person who's infectious, how many people are they going to infect? And it's like 7 to 9 for Omicron. Even if you just prevent one of those people from getting sick, think about how that multiplies.
That's right.
7 more. So now you've taken one of those out. And it, over time, that is going to decrease the number of people who are getting super sick and needing that hospital care.
Thank you so much. Dr. Davies, when you were on my show, Heartland Focus, NBC Omaha, WOWT Channel 6, you had to that shameless plug there. Okay, both of you guys was on my show. You did a great job, both of you. But I love how you explain preparation for war in terms of just, if you could explain in terms of what is. And I know, Dr. Huse, you explained in terms of the why for the vaccination, but Dr. Davies, give us your analogy of really from a war perspective, because people do understand war.
Right. So, the
body, talk to us, man.
The human body is like a country, right? So, a country has its military, and each of the military branches have their own role. So we have a Coast Guard, right? That's supposed to go out there and keep people out. We have, the Air Force, we have the Navy, etc. And so the same thing with the human body, right? So when you're born, your body actually recognizes who are the citizens of your body. Like it knows who belongs to Dele, Davies, and who does not. So if there's any kind of foreign antigen or foreign protein that comes inside me, my body says, okay, hold on a second, seek and destroy. Now, the skin has a lot of, it's like think about the skin as a Coast Guard. It's got a lot of soldiers embedded inside the skin that their first job is try and find, parts of things, people that are trying to get into your country, into your body that do not belong. That's the first line of defense. And then throughout your body, we have, your white blood cells, and the white blood cells have different branches as well. And they all have their own roles. Then we have antibodies, which are what protect you when we get the vaccine. So the idea here is that the whole idea of the vaccine is when you basically prime the body with something that does not belong to it. So you introduce the foreign enemy or component of the foreign enemy. That is, for example, with the COVID, is the spike protein. So the spike protein is not part of your body, correct? So when you give the spike protein, your body's defense says, whoa, foreign enemy detected, does not belong here. Let's mobilize a defense to try and get rid of it. Now, the spike protein itself is just a protein. You can't do anything. So your body has an opportunity to mount the response to get rid of that. Now, if it's a virus, so if we're to get the full COVID virus, there's a war that's going on, literally a war, because the virus can only, it does not survive on its own. It has to get inside your cell. The spike protein is like a key that allows you to get inside the cell, and then it's dividing. It starts to multiply rapidly. Now, the war is that it's the rate at which the virus is multiplying and dividing and taking over your cells versus the rate at which your body is able to mobilize the soldiers to fight it, that leads to whether you're going to either have a mild infection, be deathly in the ill in the ICU, or die, right? So it's really a manifestation of how quickly the virus can multiply and divide and take over your cells compared to how quickly your body can respond. Now, what the vaccine does beautifully is that it primes your body. So when you get the vaccine, right, the first dose, the body says, foreign enemy detected, get ready, right? So it goes out and wipes it out. But then it's what it says, let's mobilize soldiers that we don't normally put where they're supposed to, like where we're mobilizing them. So next time we see this thing. So when you give the second dose of the vaccine, the booster says, now this is really crazy. Now we know you're not supposed to be there. Now you have a deployment now of the armies that are ready and primed for next time you see it. So that's why, and I use the analogy, for example, that if you're fighting a war in the Middle East, right? God forbid.
In the Middle East, that's right.
Yeah, anywhere, right? You can so you can either wait to mobilize your soldiers from the United States. It's going to take months to prepare, get everybody ready, or you can have a base ready to go in the Middle East where you can actually respond quicker. So that's exactly how vaccines work, is that your body creates bases all over your body, right? So that whenever the enemy comes in, it doesn't have to wait for that attack mode to occur, for the virus to get into your cells and divide. It's ready to snap it out before it actually, attacks you. Now, the antibodies, what they do is, they wrap themselves around, the antigen, so like the spike protein, and prevent them from even getting inside the cells. Where Omicron's different is that Omicron has changed sufficiently that, the wrapping is not as efficient, right? Because think about, if you have the spike protein, that maybe is symmetrically shaped, put around the virus in the first strain. Now you have it totally different in terms of how it looks and how it's configured. So it evades your immune system a little bit more. So it's hidden, but still there's enough there that the body can say, I don't know, this doesn't belong here, let's weed it out. So that's the analogy. So your body really functions very similar to a country. And
there you go. I mean, and when you fast forward that, I mean, in real time, we're dealing with a situation with the Soviet Union, and the Secretary of Defense, basically say, hey, we're ready. We have troops in place,
correct,
systems in place. It could be a diplomatic, solution or sanctions, but all of that's been played out and put in place in terms of just scenarios of what if.
Exactly.
And when it happens, we don't have to get ready because we're already ready. And absolutely. I think that's what you just laid out.
Yeah.
That's why you should take the vaccination.
Absolutely.
I mean, just if people have questions after that, I don't know what, Dr. Huse, Dr. Davies, I don't know what to do or say.
That's probably my favorite version of how the immune system works ever. And it's actually exactly how I've explained how the immune system works to my kids. And my little person will even say, Mom, we need to teach my body to fight the, we need better soldiers in my body to fight off this cold or whatever is going on. I absolutely love that. I think it really makes it so easy to grasp. That was an excellent explanation, Dr. Davies.
Yeah, and we're recording that, Dr. Davies. So I think you signed your media disclaimer, so I can use this any way I want.
Absolutely.
But all for good, though. This is all for good. All for good. Hey, we have some questions, and if we could just, because we're coming up on 10 minutes on the hour, and if we could just try to answer a few questions real quick, and then either one of you just jump in, if you will. Someone is asking, how long can the hospital system maintain at this level of stress? What is the contingency plans? Somebody talk to me.
Well, I can start and then I'll have Dr. Huse follow. Not for long, I guess I should say. And I don't know how long is long. Part of the reason decisions are being made now is to try and get ahead of the problem and to try and, protect our staff, and make sure that, because the staff are also, they're human beings, right? I don't know if 20% of all healthcare workforce quit last year just because of the stress of COVID and just handling these patients. So this is a real issue. We have to be concerned about the psychological well-being and mental health as they continue to take care of these really sick patients. So really what we're trying to do is just stay ahead of this and try to be very thoughtful about making sure that we are able to take those patients who really need care. So those who are what we'd call, level A, where they're critically ill, we know that they have to come in, or they have life, limb, whatever, some part of them that's emergently needing care. But it does mean that those things that can be disabling. So if you have, a really bad hip that's causing you pain, you may have to wait because it's not going to kill you, but it's going to lead to a lot of disability. But we just don't have the capacity to take care of that right now. That's why I keep saying this. I'm going to go back to it. We need help. We're doing all we can. We need the help of the public, and we really need the public to understand that this is not a hoax. It's
serious.
Every day. This is serious stuff.
Yeah.
We need help, and we are doing all we can, and we want the public to do what they can to help us so that we can actually hopefully get over this hump quicker and everybody can get back to normal.
You want to add, Dr. Huse, anything there?
Yeah, I'd like to just add that we don't actually know how long we can do this. I'm going to say the same, probably not real long. Think about the strain that has been going on in our hospitals for 2 years now. I think that's even longer than we ever expected strain on our healthcare systems to last. We were really thinking, okay, it's going to be a few months. We're going to attack this thing. It's going to be over. Well, here we are 2 years later. Like Dr. Davies said, 20% of the healthcare workers quit last year. There are certainly more following behind that because people are just getting more and more and more worn out. And we don't necessarily have the pipeline and the training to replace that. So when you have your senior healthcare providers who are the experts, let me tell you, you've got to be a rock star to be an ICU nurse. I mean, you've got to, and doctors too. I know nurses, so that's what I'm speaking to. But you know, you've got to be a rock star to be an ICU nurse. Well, if your senior ICU nurses are just exhausted and have quit, who's going to train those new ones that are coming in?
That's right.
We don't necessarily have a pipeline. I mean, we have some, obviously. We have nursing school, we have medical school. We're training people as fast as we are able to. But when you have all of your experienced people kind of making this mass exodus out of the system, there's a huge component of people who you've now lost all of that institutional knowledge and all of that amazing wisdom that comes just from taking care of patients every day. And so, we really can't keep it up much longer because there will be too few people left to really help people develop their skills to be effective in their jobs.
Yeah. And I would just want to pause and say thank you, to both of you and to really the hospital staff and doctors, nurses, technicians, just every single person that is really out there doing the work. I was at UNMC this week getting a MRI done, and you can just see it in their faces that they're there, and they're there because of commitment, dedication, and their passion for the work they do. And I just simply said, thank you. Thank you for being there. Thank you for what you guys are doing. Because when you think about risk, they're taking a larger risk than most people every single day by even just going to work. And so if you're out there, please take this. And I know so many other people out there feel the same way. Gratitude. Thank you for that level of sacrifice and commitment of taking care of people. So thank you too for what you do to help take care of people. We're gonna wrap up. I'm gonna give both of you only 60 seconds, 1 minute with 60 seconds in it. So be thinking about a statement of action to summarize really what's in front of us, what we need to do really that's caught up in the name of this town hall series, moving people to action. And I got one last question. Somebody said, hey, when are you going to ask my question? You got to ask my question. So it's about the little babies. As young children are getting sick, having some symptoms of COVID-19, but when tested, they're negative. Does this usually mean they are a carrier, or that's kind of the question in terms of with young people?
So, there are two ways to look at that. So there's something called MIS-C, which is multiple inflammatory system COVID in children. And it's a condition where you would have had COVID. So you may actually test negative on your nasal swab. But if we were to do antibodies, we'll show that you've been infected sometime in the past. And those patients come in and they have, really severe symptoms. They may have swollen heart. They may have, inflammation of their kidneys. The blood counts may be low. And, it's an inflammatory condition that's very similar to something we used to call Kawasaki disease, which I won't get, into. But so that's one possibility, is that they have MIS-C. The other possibility is that there are other conditions that, prior to COVID, we would think about, but maybe people are thinking more like COVID. So it would be like influenza, for example, is in the community right now. And the other viruses like RSV that can also lead to symptoms that can be very, very similar to what you see with COVID. So the answer is, if they went to, children's or a place where the testing capacity is possible beyond COVID, then they may be able to get, a rapid test that tells them what the condition is beyond, if it's not COVID.
Yeah. You want to add to that, Dr. Huse? Are we good?
He hit the nail on the head, and he's the expert on those conditions. So
yes,
very
he
good.
Is. Yes, he is. So before you think about your 1 minute with 60 seconds in it, if you will, what would you recommend? I mean, because there's so much confusion out there and just misinformation. Can you identify a source that people can maybe go to reinforce this conversation tonight? That people can seek facts and information that, like you said, hey, both of you, including I, Raheem, we're fully vaccinated. We boost for where are we getting our information? What makes us want to create a situation that's going to put ourselves at harm, right? So is there a website or something that you can point people that's still on the fence, that they trying to find the truths and facts?
So I could start and then hand it over to Dr. Huse. There are several credible sources. I would say start off with the Centers for Disease Control site. They have, credible information that's up to date, and they update their site, and the information is very good. Then there are a lot of organizations. So if you're looking for information on children, I recommend going to the American Academy of Pediatrics. It's a very credible site that they will give information. Everything that you really need to know about children, you can find out through the American Academy of Pediatrics. There's also the Infectious Diseases Society of America, which is another organization that, is an organization of all the infectious diseases leading experts in the country. I'm a member of it. And it's one where, again, they will be able to give you very credible information. The Pediatric Infectious Diseases Society is another organization that's like a sister organization to the Infectious Disease Society of America. So yeah, there are a number of credible ones. And I would say, CDC is a good starting point. And then locally, Nebraska Medicine, UNMC.
I knew you probably was going to say that one, Dr.
Yeah, I have to. We have a ton of information.
That's the paycheck.
Well, we do have a ton of information on our website that's
absolutely
local, that's got local content, and Douglas County, of course, Dr. Huse, I'm sure would say the same.
Yeah. Any did we leave out any, Dr. Huse?
Those are exactly the same sources that I would recommend. I would add to that, don't just Google it. So if you stick with those sources that do what I would call old school science. So they're still following the scientific method when they're doing their studies, and they're having their studies peer reviewed. So anybody can self-publish, especially in the age of the internet. It's really important that you look for those sources that would have been peer reviewed. And basically what that means is that other scientists who are familiar with how research should be done and what would be correct for that field are basically looking at that research before it's published officially and making sure that it's sound. So look for peer review. And yeah, those same sources, CDC, American Academy of Pediatrics, the Infectious Disease Society, all of those are fantastic. We keep more local data on our website, but I will say that we are actually trying to add more actual science related pages to our site, so that if people say, gosh, I really wish I had more information on the science behind masks and how effective they are, they'll be able to go find a whole list of those peer-reviewed scientific sources. So yeah, I think that Dr. Davies hit it right on the head.
Right on. Hey, and we put some of those sources in the chat box, in the link there, you can actually, there's links to some of those sources that you guys have identified. You guys, that's all. I mean, we're at an hour, a little bit over an hour, and just really want to thank the two of you for taking the time to share your thoughts. And I mean, it's just very obvious that you're committed and passionate about the work. And please know that moving people to action will be an ongoing platform that will serve to educate, increase awareness, and really, hopefully enough to cause people to move to action in a positive way. And we will always commit to facts and really not opinion. And I think we're living in a time where I think we got to put the opinion on the shelf right now. There's too many people dying and decisions are being made. I think they should be led by scientific evidence, facts, more than individuals' opinion. So that's my 60 seconds. And I want to thank, you never get this done by yourself. And so as a staff of folks that help to produce and behind the scenes, so I do want to thank Jessica Clark, Raheem Sanders, and just our support staff that helps makes this happen. This is something we do on a monthly basis. Our next episode will focus on mentoring. Actually, January is mentoring month, and so our sponsor will be the 100 Black Men of Omaha. Will be focusing on a town hall about really the need to get more adults in the lives of young people, especially having a mentoring relationship. So we'll go down that road because, you know what, when you think about it, both of you, you know, probably more than any time where young people need an adult to help guide them through this mess that we're in, and just not alone the pandemic, but look at the social injustice and, you know, the insurrection, the politics, all that crazy stuff. So with that, Dr. Huse, give us that 60 seconds. With 1 minute, 60 seconds in it is forced upon us. We're not going to abuse it. Let's use it.
I would like to trade my 60 seconds for 90, please. I'm kidding.
Hey, we can do that because I talked to I did talk to Phil about you guys becoming a sponsor of this. So hey, go ahead and take 90 seconds, okay?
I love that idea. So my 60 seconds, I want to talk foundational and love. What that is, it's love your neighbor. That's basically, that is the theme that I try to live my life by. I think that it's also the only way that we get through this pandemic in okay shape. We have to love our neighbor. And sometimes that means that we have to step out of our comfort zone, and we have to do some things that maybe aren't as fun, but we know that it's going to be good for the people around us. And you know, we cannot live without connection. We are wired for connection with others, and we're not going to be effective at that, or at solving the pandemic or getting through it if we don't just love our neighbors. So that's my big spiel for my 60 seconds.
Wow. And that's really, that's one of the orders. I mean, we could talk about love thy neighbors all night, you know, another hour, but your point on, I love that. Dr. Davies, tell me something.
Well, how can
profound?
How can I top love your neighbor? I mean, I love it. I mean, absolutely.
I know. How do you top that? How do you top love thy neighbor?
I'm all into absolutely that. And, you know, so it's a takeoff on that, right? You know, we're all in this together. We have to get through this together, and we cannot think of ourselves alone. We have to think about our communities, our family members, our neighbors, and just think about how we're going to help those people who are the most vulnerable amongst us get through it. It's not just about us. So again, it's just, please get your vaccine. Please do your part. help us to get over this. We cannot do it alone. The health system cannot take care of this by itself. You know, healthcare workers are people too. They also have emotions. They also have, you know, family members that worry about them. And so we need everybody. If we all get on the same page and for a period of time, act together, we'll get over this. So again, just, you know, please, let's all work together and we'll get through this together.
Right on, right on. Hey, I want to thank all of our viewers for tuning in and on our YouTube channel, Facebook, and on Zoom. Thank you so much for taking the time. And please, if you find this to be helpful, please share this information that someone else may be able to learn. And you never know how it's going to move someone into action. And actually folks that have been, you know, sitting on the sidelines and watching or straddling the fence when it comes to taking the vaccination, it may move them to take that vaccination. So we can all do our part to help stress down the system. Hey, that's all for this episode of Moving People to Action. Until next time, do what's necessary to do your part. I'm out. We're out of here. Thank you guys so much.
Thank you.
Thank you. We'll be in touch. Thank you, Raheem. Phil,
Thanks,
Rooney.
Raheem.
Thank you.
Yeah, thanks, Raheem, and nice meeting you, Dr. Huse.
You too. So good to be with you on this, Dr. Davies. Thanks,
Many more. We're gonna keep this. We gotta keep moving and agitating this. You know, it's got to be a major disruption in a positive way.
Well, you're the perfect person to facilitate it. You do an amazing job.
Yes, actually.
Well, thank you. Hey, check is in the mail. Thank you guys so much. God bless you. God bless
Have
you.
a good night.
Okay, good night.